In this short video, we'll review CLSI's new guideline EP39, a hierarchical approach to selecting surrogate samples for the evaluation of in vitro medical laboratory tests, first edition. The new EP39 guideline establishes a definition of a surrogate sample, provides recommendations for determining when to use surrogate samples, and describes a process for selecting the most appropriate surrogate sample. The intended users of this guideline are laboratory professionals, in vitro diagnostic device developers, and regulators. The EP39 guideline does not describe performance study design, which is covered in other standards and guidelines. Please see CLSI document EP19, free on CLSI's website, for more information. Surrogate samples serve an important role in the development, validation, and verification of laboratory tests. Surrogate samples may be needed for many reasons, including when there is limited sample volume, when there are inadequate numbers of patient samples with concentrations at medical decision levels, and when there are inadequate numbers of patient samples with concentrations at the extremes of the analytical measuring interval. The EP39 guideline defines a surrogate sample as a material or combination of materials used as a substitute for body fluid or tissue taken for examination from a single human subject to study the characteristic of interest. The EP39 guideline discusses surrogate sample composition, technical preparation, selection criteria, documentation and planning, and the use of surrogate samples in specific performance study types. The EP39 guideline also describes the principles for creating a surrogate sample plan and presents a hierarchy, by performance study type, for selecting an appropriate surrogate sample. The hierarchical approach is demonstrated through product and performance-specific examples. Applications of the surrogate sample hierarchy vary by performance study type. This guideline explains how to apply the hierarchy to specific performance studies and how to choose an appropriate surrogate sample type for the respective performance study. The different performance study types discussed are linearity, analytical specificity, precision, detection capability, matrix comparison, method comparison, hook effect, sample stability, carryover, and reagent stability. EP39 describes a methodical approach for determining the suitability of using surrogate samples in different situations. It discusses the potential limitations of surrogate samples, as well as mechanisms to manage these limitations through appropriate sample construction and performance study design. EP39 is available now and may be purchased from CLSI's website, www.clsi.org. As always, CLSI thanks you for your interest in our standards, guidelines, and other products for your laboratory.